I've got a few questions here that me and my support worker have put together from FFT. I got a letter for cervical screening. I just want to know what it's about and what you could tell me about it, really.
Okay, well, it's lovely to see you, Mary.
Thank you.
I'm really pleased you've come along today. So anybody who's 25 to 64 all get invited for a smear test.
Yeah.
And it's I'm not going to lie to you. It's it's not a particularly nice procedure, but the procedure just takes a minute, 2 minutes of your time. It's over very, very quickly, and it really shouldn't be painful.
Who will be doing it? Will it be a man or a woman? Because in my community, it'd have to be a woman.
So what I suggest you do is when you make your appointment to come and have it done, make sure you ask for a female. There are male and female doctors and nurses, but if you ask for a female, then they can make sure they book you in with someone.
Yeah. Will it hurt? Will it be painful? A lot of travelling girls do, they've heard stories.
Yeah. It can be uncomfortable. I wouldn't say it's painful. What you have to do is you are going to have to undress from the waist down. So I usually suggest that maybe you come in a skirt or a dress. You'll then have a screen put around the couch in the room, and you'll be asked to get up on the couch. We give you a little blanket, dignity blanket of made out of tissue or paper roll that you put over you to hide everything. Then we have to sort of look at your private area. We put a brush up inside you, which is a very, very soft brush. Yeah. And then we take a sample from inside you, and that procedure takes about 2 minutes.
So not long at all?
Not long at all. It's just, it can be a little bit uncomfortable, but it really, really shouldn't be painful.
That's good, that's really good. So I live in a house, but obviously there's a lot of travellers that move around. How would they get invited, or how they would get the results?
Okay, so if they are travelling around and they do need to be registered at a GP practice, so they can contact the friends, families and travellers who will help them to register at a GP practice. Then once they are registered, to get their results, usually the results are sent by letter. Yeah. But if they aren't unable to receive that letter or read or write, then whoever's taken that smear test can actually give them a ring with the results.
Oh, that's brilliant.
Or they can get a text message. But obviously, again, we need to make sure we've got their correct phone numbers as well.
A friend of mine she was pregnant. She had a checkup, and they told her she had to terminate her baby, because they found something. Is that rare, or does that happen?
Yeah, I mean it's very, very, very rare, I would say. But at the end of the day, that's what makes it really, really important. You come and have your smear test first of all before you even get pregnant.
Yeah. Thank you very much.
You're welcome.
If you want to talk to someone, contact FFT's confidential helpline on 01273 234 777.